Thanks so much for joining us for this Monday's COVID-19 press briefing. Today, Orange County Mayor Jerry Demings will discuss our goals for the week. But just before he does that, he will talk briefly about our positivity rates. The mayor will also provide an update on coronavirus cases and a look on where we stand on vaccinations and testing. The mayor will have details on the I Got My Shot trailer and provide an update on emergency rental assistance. Dr. Raul Pina from the Florida Department of Health in Orange County is here to report on important COVID-19 trending data here in our area. And last but not least, Comptroller Phil Diamond is here. He will bring us a report on tourist development tax collections. We begin with Mayor Demings. Mayor?
All right, good morning. Hopefully all of you had a great weekend this past weekend, and we look forward to an even better week. As we begin today, we do have some others who we have backup as we get to the Q&A. We have Mark Tester from our convention center, our executive director there, Dr. Yolanda Martinez, our health services director. We have Commissioner Nicole Wilson, and we have Scott Howard from the Orange County Public Schools, and Commissioner Myra Uribe as well. That's who I was looking for. And we have Ricardo Day from our HR if we have any employee-related questions that come up. And with that, we'll go ahead and begin today. I am honored to talk a little bit about this last weekend. We had the opportunity as a county to participate in the Come Out with Pride Most Colorful Parade. Several of our commissioners and I participated with our employees in that endeavor on Saturday. It was a great event to be outdoors and be able to come together and gather. It's been, as you all know, difficult year and a half for all of us, and so that was a good event. According to the Florida Department of Health, our daily positivity rates are continuing to decline, and so that's good news for all of us here within our community. According to their numbers, we have dipped below 5% in the daily positivity rate last Friday. The last time that happened was back on July the 2nd. The revamped Department of Health numbers are also showing Orange County's daily positivity rate is now below 5%. However, I will tell you that the 14-day positivity rate is at 6.04%. And so I'll talk more about that in just a few moments, and Dr. Pino will share additional details as well. I know that when we talk about the numbers in some regard, when you hear daily rates, 14-day positivity rates, it can be a little bit confusing for our public, but I want to remind all of you that once we get to a sustained 14-day positivity rate, that means for 14 consecutive days of it being 5% or below, we would have reached the pinnacle that we're striving for of low transmission here within our community. That will likely coincide with the CDC reducing our status of being at high risk to a lower risk of transmission for the virus within our community. Now really is not the time for us to relax wearing the facial coverings or doing the other things that we are striving to do. The goals for the week, obviously, as we continue to fight the spread of the pandemic within our community, that remains our number one goal, is to get our positivity rate at the 5% or less. And number two, to ensure our residents have access to free testing and vaccinations to continue to provide rental assistance to our residents who are affected by the pandemic. And lastly, to continue to encourage residents to get vaccinated. That really represents the various goals that we have for the week. Sadly, I do have to report that we do have over nearly 230,000 coronavirus cases reported in our county. Since our last news briefing a week ago, there have been over 1,500 new cases. The number of Orange County residents who have died from COVID-19 has continued to increase. We increased by 45 fatalities since last Monday, and we're now nearly 2,100 people have died of the coronavirus within our community. Dr. Pino will talk about those numbers. Also, as we look at the percentage of residents 12 years of age and older who have received the vaccine of at least one dose, we're at 74%. That is very encouraging for our community. This past weekend, our free vaccine site began operations at Barnett Park on West Colonial Drive. Barnett Park offers vaccines for eligible residents. They're offering Pfizer first and second doses and booster shots, Johnson & Johnson for the one shot, and Moderna for the second shots only. For more information about vaccines, you can go to our website at ocfl.net/vaccines. And I'll talk now about our campaign, our I Got My Shot campaign, which is another way to ensure that we get out into the community. We're moving our mobile vaccination trailer around in partnership with the Department of Health. There are multiple locations each week, and on Saturday, the mobile vaccines will be available at the Orlando Science Center between the hours of 10 a.m. and 5 p.m. For those people who get vaccinated at this event, the Orlando Science Center is giving a complimentary ticket for their next visit back to the center, which can be used on Saturday. Getting a vaccination is free and is available on a first-come, first-served basis while supplies last. For more information on the I Got My Shot trailer information, you can go to ocfl.net/IGotMyShot. Again, free COVID-19 testing is available at 2 locations in Orange County, Barnett Park and the Econ Soccer Complex. As a reminder, the former Claricona Elementary School is no longer a testing site. During the 2-month period that site was operational, nearly 33,000 tests were given at the Claricona Elementary site. The other 2 sites remain operating 7 days a week. Barnett is open between the hours of 9 a.m. to 5 p.m., and the Econ Soccer Complex is open between 9 a.m. and 4 p.m. Again, information at ocfl.net/testing for details. Last week, we reached a milestone with the Orange County Emergency Rental Assistance Program. We surpassed the $10 million mark by approving more than $10.8 million to help our residents pay their rent. As of Friday, those dollars helped nearly 2,000 applicants who have been struggling during the pandemic to pay their rent. The program is available to help our residents, and you can get information about the Emergency Rental Assistance Program at ocfl.net/emergency rental assistance. As a reminder, the Orange County redistricting meeting takes place tonight at Barnett Park, which is in our District 6 area, starting at 6:30 p.m. Tonight's meeting and the next 5 meetings will take place in each of our 6 county commission districts. In other words, we're moving it around the county. Next Monday's meeting will be in District 4 at the South Econ Recreation Center. We'd like to remind you that if you cannot attend the meetings out in the community, you may submit a public comment through our website at ocfl.net/redistricting. The meetings are also available on Orange TV and our county social media channels. Before I turn it over to Dr. Pino, I'd like to inform everyone that Saturday, October the 16th, we'll be holding our annual Orange County Community Conference. This year's conference will be virtual and available on Orange TV and Orange County social media platforms of Facebook and YouTube. The conference provides our residents a great opportunity to learn about innovative ways to improve their neighborhoods and provide a quality of life that works for everyone. We'll have guest speakers and workshops, and I'll be hosting a live chat with residents to talk about the future of our great Orange County. The virtual Orange County Community Conference takes place between the hours of 10 a.m. and 1 p.m. on this coming Saturday.
Thank you, Mayor. As the Mayor mentioned, 229,673 cases has been diagnosed in our county. Our positivity rate for 14 days average is at 6.04. I probably should be by 5 by when we talk to you on Thursday. The number of deaths has increased to 2,090, And if you saw a move in the numbers, it was because one case was duplicated and eliminated from the roll, and one other case was reassigned to another municipality. So that's why, if anyone noticed a little bit of number of two, but 45 additional cases has been reported to the state, 20 female, 27 female, and this is when the 47 comes, so that you see I still have in this data the two added cases. 2 Asian, 16 black, 28 white, one other, 12 Hispanic, 35 non-Hispanic, and our condolences goes to the families and friends who those who have died. 2 deaths were from July, 45 from September, and one death was from October. 4 of the deaths are from assisted living facilities, that's 8.5, and 11 were fully vaccinated for a 23.4%, and 2 were partially vaccinated. On good news, the CDC has moved our level of transmission down to orange. So orange is orange back. We were red for a while, and we see that these will move quickly into the lower level too. Now, another thing that I want to say before I talk to the vaccine numbers is that, and I want people to understand this piece, for public health, this flu season that is going to start is a critical season. And why is that? Because last season, we have little flu. We have very little flu last season due to the fact that we were practicing all those preventive measures for COVID-19. Indirectly, they had an impact on flu transmission because flu transmit lower rates than COVID-19. So the masking, the hand washing, the distance, and everything else that we have done gave us last year probably the lowest flu season that we have seen in recent history. So what it's going to do, could do, is that many people were not exposed to flu last year. So this year, their immunity for flu, community levels for flu immunity will be lower than normal. So with that, it is important to get vaccinated for the flu starting now. The peak of the season for our area is around at the end of January, mid-February. So it is important to get vaccinated for flu. The vaccines are out there, and in many cases, they are for free. So please get vaccinated for the flu. And on vaccinations, I want to give you some good numbers that we have seen, but also call the attention on a number of people that still have one dosage for the vaccines that have not reached and that they are out of the range. For example, in all our residents, about 9% of all our residents, about 116,858 have not received their second dose. Now, it could be that they're receiving another municipality, it was not entered in our system, in another state, that's possible, but not for that large number of individuals. When we go to 12 to 17, about 15,000 have not received their second dose. And what I'm saying is they already received their first dose and they are 2 weeks after, 4 or 21 days or 28 days after the vaccination. Of course, these exclude J&J. And for people who are 65 years or older, we have about 14,000 that have not received their second dose. So that second dose is important to complete your series and then wait about 6 months to get your booster. So for those individuals, please get your second dose. Now I'm going to give you the age group, the first series and complete series so that we have the full numbers. For all residents with at least one series we have 922,679, and that is 70% of our population have received at least one dose. Fully vaccinated for our entire population, and this is a very good number, 65% of our entire population has been fully vaccinated. For people 12 to 17, at least 72,257 have a first dose, and that is 66% of the people in that age group, and that's actually a very good number for that age group. And fully vaccinated, 52% of the same population. For people 65 years and older, which we consider to be a higher risk for negative outcomes from COVID-19, with one dose, we have 157,741, and that is 88% of the population have received at least one dose. And for the complete series, is 80%. So with that, we have reached great immunity levels together with the vaccinations and the natural immunity and the monoclonal immunity. I think that we are in very good shape, and these numbers will continue to go down. So please keep these measures up, keep protecting yourself, and especially children younger than 12 that are not eligible for the vaccine yet. Thank you. I should pass it to our controller, Phil Dime. Is that?
Thank you. Thank you, Dr. Pino. Good morning, everybody. I'm here to report to you on the August tourist development tax collections. And in the month of August, the TDT collections were $16,462,100. Where does that stand with past numbers? Month over month, the August collections were lower than July collections by $8.2 million. They were also lower than August 2019 collections by about $3.5 million. To put that in context, TDT typically dips in the month of August just because students are returning to school and less families are vacationing in the month of August. However, I think it's fair to say that TDT collections drop more than might have been expected for that reason, simply because of COVID and the impact of COVID. And as I think someone said, as COVID goes, so goes our economy. That said, the August collections were the lowest that we've had pre-pandemic in any pre-pandemic August since August of 2015. However, they remain significantly above where they were at the beginning of the pandemic, or at the pandemic. You will have a chart that will be handed out by our public information officer, Kathy Glatt. And by the way, if you're at all confused about the names, Kathy used to be Kathy Dixon, but she got married a week ago, so congratulations to her, and all the best wishes. So on the TDT reserve side, our reserves increased for the month of August by about $5.6 million. And the reason why that seems to be different than you might expect from a month where you collect $16 million is this. There's a 2-month time lag between the time when TDT is collected and when it's remitted, received, and recorded in our books and records. That said, August reserves reflect June TDT collections, and on a cumulative basis since the start of the pandemic, the county has used just over $140 million of reserves to meet its TDT obligations. So our undesignated reserves decreased from $181 million to $41 million, and obviously we look forward to good collection months where we can begin to replenish the amount that we've used. Finally, we will have the September collections for you sometime in early November, and I'll be glad to take any questions you may have during the question and answer period. So thank you.
Well, thank you, Controller Diamond. I do find a bit of good news in the numbers that he reported, because you all know that August, as it relates to the pandemic, was the most deadly month that we had since the pandemic began. But it also speaks to the fact that because we had $16+ million collected, that we remain open for business. And we were able to do so in the safest manner possible because of the various protocols that were put in place here in this community. And we had a plan. We worked with our entire business community to ensure that we remain open. People continued to come here because they felt that overall it was a safe community to come and to vacation in, come to visit, etc. So I do look forward to those numbers increasing as we move forward away from the pandemic and the high rate of transmission that we were in at that period of time. We're going to open it up for questions at this time, and if there are questions for Spanish-speaking media, we do have Ms. Ilia Torres, my special assistant, who can assist with translation, and of course Dr. Pino is fluent as well, and Dr. Yolanda Martinez from Health Services is also fluent in Spanish. And so we'll open it up. Just as a reminder, there will be a microphone that will be moving around. So wait on the mic to get to you before you ask your questions.
For Mayor Demings, in the second part, if Dr. Pino would like to weigh in as well, Lauren Cervantes, News 6, you mentioned declining positivity rate with the daily rate under 5%. In terms of pulling back on masking, what does the next month look like, and what's your message to those that might have fatigue when it comes to COVID measures?
Well, each individual is going to have to make some decisions that's unique to their set of circumstances. We continue to encourage individuals when indoors in crowded spaces to wear facial coverings. So in terms of the fatigue, I think that we're not yet where we need to be. Again, we want to get to the point where we have a low rate of transmission that is recognized by both the CDC and by the various health experts here within our community. So we're on our way to that number. So I just ask everyone to be persistent, patient in working with us to get to that point. We continue to have various mandates in place, and from the schools to other locations where adjustments are going to be made as those numbers begin to decline, but we want to get to a sustained period of time where the rate is 5% or below. Dr. Pino.
Well, not much to add, Mayor. I think you touch everything, but just a little bit longer, just a little bit longer. We just have to hold a little bit longer. We are almost there. When we vaccinate 5 to 12, we are going to be in a very good shape as a community, and that's why we will move quickly to try to vaccinate as many as we can, as fast as we can in that age group, because that's the last shield that we have against any future outbreaks.
Hey, Andrew Ferguson, Spectrum News 13. I'm sorry. Dr. Pino, you mentioned flu season and getting vaccinated for that. In regards to last year's numbers, did COVID hide any of those cases, or was it as bad as it usually is? And if you could just describe hospitalizations of the flu on average.
It was basically on gray scales. It was basically not existent. That doesn't mean that people may not have the flu here and there, but statistically speaking, it was basically not existent. And I know this is going to make some people feel iffy, but it was the mask. Masks do protect against the flu. Other cultures, especially in Asia, are very accustomed to use it during flu season. That's why their flu seasons are not as aggressive as our flu season. It may be something that people may consider in the future as we move forward during future flu seasons. But it's an individual decision.
right, this is Melissa Thomas with Florida National News. I guess this question might be either for Mayor Demings or Scott Howard if he's here, but just wanted to get you guys' thoughts on, now that the numbers are beginning to decline, how do you feel that now impacts the school system and the education system?
That's a Scott Howard question there.
Well, thank you, Mayor. Certainly, we're monitoring the data closely and looking at not just the daily rate that dropped below 5, but the overall, the 7-day and 14-day average. Our board's looking at it. We do have our current mask requirement in place, continuing through October 30th. As of now, we're continuing to, as I said, monitor the data, and as Dr. Pino said, just a little bit longer. We're asking, and as the mayor said, for patience as we continue to push forward to get that long-term consistency below that 5%. I think the board's looking for that. The superintendent certainly is as well. So good question, and we're going to continue to push forward as Dr. Pino said and the mayor said. Thank you. Thank you.
Mayor, sorry, go ahead.
Something that people may not know yet is, and that goes into what Melissa was saying, is that we are also working very close with the Board of Education and developing a pilot. We are in the process of selecting one school where we will test 10% of the student population weekly. We are going to try to get to that 10%. We are working on consent forms and getting all the resources together, because this will give us a better idea of what asymptomatic cases may be around, and if we are clear as we think we are. So yes, the school is working very closely with us in keeping track of those numbers and trying to find the answers that we need so that they can make informed decisions.
Mayor Greg Fox from West TV. I believe the Sentinel first reported that it's got a number of violations that the health department is looking at. Can you bring us up to speed on what the legal response from Orange County is going to be? And are you also working with the city of Orlando, since it looks like Amway Center is also part of that violation list?
At this point, we have not received any correspondence from the state, from the Department of Health, or any other entity that specifically says that we will be fine. And so until that occurs, we're status quo. If we receive information that we will be fine, given the directives that we have put in place here, we will end up in litigation over it. So that's where we stand.
Can I do a quick follow-up? Do you expect that they may, to resolve any violation, may ask you to rescind the letters of reprimand from filing?
I have no way of knowing what the state is going to require. What I will tell you is that from the very beginning, our legal team looked at the law, and the directives that we put in place were to comply with the law. And it just may be that I think when the state sent us the correspondence at 4:52 p.m. on a Friday, it perhaps predated some finality that we had with labor discussions with at least one of our unions, the fire union, and I don't believe they had accurately reviewed what we were doing here within Orange County. Of course, they now are armed with the specifics of what we have done here, and it just may be that they have made a decision that we're not in violation. So I won't assume until we receive something more definitive that we are in violation or purported to be in violation. So we'll just have to wait and see. And but if everything that I've said now, if they attempt to fine us, that's taking taxpayer dollars from taxpayers here in Orange County, when in my humble opinion, my professional opinion, based upon the input that we receive from qualified medical experts as well as legal experts, our directors comply with the law. So that is our position, has been our position all along, and we'll just have to see. Okay.
Lauren Seabrook, Channel 9. Dr. Pino, some of the pediatricians in town have been telling us that they're expecting the FDA to approve for 5 to 11 in probably a week or so, maybe a little bit longer. Do you have a plan yet for how to do those vaccines? Is it going to be any different? Are you going to be at schools? What's that look like?
So all depends also what kind of support and resources we received. We are contemplating all the options, working with the county on the school system. It could take different ways. What is different right now is that the vaccine is available in many, many locations around the county, more than 100. So people are going to have a choice where to go quickly, get the children vaccinated. Providers, pediatricians can order the vaccine and get it into their offices to provide the kids with the necessary immunity. And the board has been very insisting in be able to provide vaccines at the school to facilitate that process. We also have contemplated the possibility of doing a mass vaccination site, but with children, especially younger children, that presents a challenge because the best way to do this type of vaccinations is through moving vehicles, and then sometimes the kids have to come out of the vehicle. Some kids are rarely scared, may run, so there are all the considerations. So the safest environment to provide a child with vaccination is that where if the child is young enough, the parent is within in a private room where they can receive the vaccine. And that's ideal for clinical settings.
Steve Hudak from the Orlando Sentinel. This is for Mayor Demings. Mayor, I know you've already sort of addressed the story that the Sentinel did about vaccine passports and mandates. Were you surprised, first of all, to see your own name on that list? And then also, how do you feel about that and all the arts groups that were named?
I haven't seen the list, first off, but I'm told that Orange County's name may be on the list. But in either case, I believe that as it relates to fighting this pandemic, it starts in our local communities. It is here, it is in our local communities where our firefighter, paramedic, EMTs respond to the crisis. It is here in our local community where our nurses and other healthcare professionals, including physicians, et cetera, are dealing with the pandemic. And so I believe that whenever there's intervention by the state or any other government that diminishes our ability to protect the residents that we ultimately are responsible for, including our very own employees, that doesn't make sense to me. It didn't make sense to our lawyers. And I think in a situation like this, like every other crisis that we have to deal with, whether it's a barricaded gunman situation or a hurricane response or some other major incident, flood, et cetera, in our local communities, it is the local communities that have to respond to those situations from the very beginning to mitigate the damage, to protect our citizens. So to me, the state was clearly out of line with commonly accepted practices for crisis management. You know, all of you know that I spent nearly 4 decades as a crisis manager, managing and leading various types of responses to crises. And anytime that anyone diminishes our ability to take care of our citizens, I'm going to stand up against that. And that's what we did here in this county and other counties, other municipalities, as it relates to vaccine passports. You know, there's been some litigation there, even for the private sector. Private sector businesses and others have made some decisions to do various things to protect its patrons, to protect their employees, and at this point, you know, the courts have not reached a final decision, but the indication is that the Florida law flies in the face of our Florida Constitution and perhaps in the face of common sense.
Good morning, Mayor Demings. Crystal Moyer with News 6. I wanted to ask you a little bit about your reaction to this investigation that's been mentioned. Throughout the pandemic, there's been some contradictions between orders and laws of the state and orders and laws from President Biden. I want to get your reaction on that as it pertains to the vaccine passport investigation.
A lot of confusion has been created. Obviously, not long ago, the president came out with some directives directing that certain categories of employees, employers have to vaccinate certain employees, those primarily in healthcare fields, working in our Head Start centers and other places. So, you know, that created confusion at the federal level. Are we subject to those directives? Are we not? And in some cases, it does not comport to what the state of Florida has done. So we're in a state of flux and confusion, as you indicated. So again, I believe that all of this is going to work itself out. In the interim, what we have to do is continue to protect our people, continue to execute the broad plans that we have created here within our county in consultation with healthcare experts, those who are medically qualified. Over time, we have reviewed research from the University of Central Florida and others. We have worked with the Department of Health here at Orange County, which is a state entity, and Dr. Pino, to fashion out directives that I don't believe that there has ever been a directive that under my signature was instituted that Dr. Pino didn't professionally agree with. Now, I can't speak for Dr. Pino. He works for the state of Florida. And on every one of them, I consulted with Dr. Pino. He has a different boss now. You know, there's a new Surgeon General. In other words, there's a new sheriff in town that has now come up with different directives, and that, in of itself, has created some confusion because it is inconsistent with, you know, for the 18 months or so that we were actively dealing with the virus. You know, we had a Surgeon General that was in place. We now have a new Surgeon General that has come in and issued all types of directives. So did we create the confusion? I don't think so. I think the confusion has been created by others. We have been consistent in the application of ensuring that we do not spread the virus, that we take all of those protocols into consideration, that we try to get up the rate of vaccination within our community, because the research has been clear that vaccinations, the wearing of masks, social distancing, all works to reduce the spread of the virus, and that's where we have been. We have not been inconsistent in this county in how we've dealt with it. The schools have had the burden of trying to look out for the students, the children, our children, who are going to the schools, as well as their employees, and they took some action, some deliberate action to be able to do that at a time, mind you, when we had the highest rate of transmission in the history of the pandemic, this current pandemic. So we all were doing what we thought we could do to protect human beings. Unfortunately, you know that politics got in the way of this from the very onset, and people made some decisions irregardless of what the science was telling them. And so that's what is happening here is not, I think, different from what is happening in any other metropolitan community or almost any other community around the country. This is indicative of just where we are as a nation of people.
Eric Sandoval with News 6. This question is for Mayor Demings. We've had some landlords reach out to us in the newsroom concerning your emergency rental assistance program. Some of them say that they applied when this program was first initiated in March. They have not yet been approved because of what they call a high threshold of document requirements for this program. Their tenants aren't able to find the appropriate documentation. They're very frustrated about this. What would you have to say to them?
I think those are probably few and far between, but we have guidelines that we have to follow. These funds are derivatives of federal dollars, and they have guidelines that are established by that every local community across America has to follow. It's not free money. They do have to demonstrate at this point that they have had a COVID-19 impact. And so the burden is on the landlords and the tenants to be able to produce those documents that we are required to do, so that when the federal government audits the expenditure of those funds, perhaps when I point to our controller that is over here, we're the only county in Florida that still has an elected controller, in other words, an elected auditor. His job and that of his staff is to make sure that we have complied with all of those guidelines, and so that's what we're doing. We are in conversations almost daily with the White House Intergovernmental Affairs Office, as well as the CDC and others, about what we think may need to be some modifications made in the guidelines. But at this point, the federal government has yet to actually modify the guidelines that we are all held to.
And I have one question that was texted in from Mike Gramajo from Telemundo. This question is for Dr. Pino, and he'd like a response in English and in Spanish. The question reads, Dr. Pino, hospitalizations are down across the state. What can you tell residents in regards to where we're at in the pandemic right now?
So where we are in the pandemic is in a sustained decrease of infections, and it should continue. Our vaccination rates are at such levels that a community outbreak like we had in recent weeks, one large outbreak, will not be feasible because of the levels of immunity. It will take a variant of very aggressive nature, and that, does breakthrough cases through vaccinating individuals to get into a major outbreak. So la pregunta, oh, I didn't say the question in English. So the question was, I'm sorry, I should have that first. Oh, you said it in English, okay. The question in Spanish, it all becomes one language, and people don't get it. When you speak more than one, it all becomes, one language. And so en español, estamos en estos momentos, en el momento que estamos en la pandemia, es en un momento está declinando constantemente y debe continuar de esa manera aceleradamente. Con los niveles de inmunizaciones que tenemos en la población, no es posible que haya un outbreak del tamaño que tuvimos anteriormente. Pero por eso continuamos. Hay segmentos especiales de la población que no se han vacunado a todos los niveles, y la población latina es importante que nos vacunemos. Es importante que protejamos a los adultos y a los ancianos, porque vivimos en hogares multigeneracionales y eso representa un incremento del riesgo.
Right, it appears that is the last question. Just as a reminder that the next press briefing is scheduled for this coming Thursday, the 14th at 4:30 p.m., so we hope to see you all there. Those who participated in the briefing today, if you all desire to have one-on-ones with any of them, they're here. So thank you all for joining us.